Hello friends, good evening. Welcome to INICET PYQ series. Am I audible and visible? Can anyone message me in chat box? Chat box. Yeah. Yes, Rakesh, good evening. So let's start. Okay, good evening everyone. Good evening Rakesh. Good evening. Yes, the first question. What is the cause of death in case of electrocution? One very commonly asked question in exam, especially the burn injuries. Rakesh, Swati Kannan, Saloni Priya, good evening all. What is the cause of death in electrocution? Options are ventricular fibrillation, respiratory paralysis, both A and B, vasovagal inhibition. As you know, electrocution, the most common cause of death is ventricular fibrillation. But sometimes, because of high voltage burn, the cause of death can be respiratory paralysis. So the best answer for this question, the electrocution, both A and B. C is the correct answer. The commonly asked questions are endogenous burn. Endogenous burn is also known as entry wound, known as Joule burn, is a classical of low voltage electric wound. High voltage electric burn injury characterized by crocodile skin burn. And one more very commonly asked question, filigree burn. The filigree burn, arborescent marking, and Lichtenberg flower burn, that is classically seen in case of lightning. So filigree, that is equal to lightning. So answer for this question is both A and B. The ventricular fibrillation is the most common cause of death. In high voltage burn, it can be respiratory paralysis. As you know, respiration is controlled by brainstem. So that is neurons present in the medulla that carries, that is or that regulates inspiration and expiration. Apneistic center and pneumotoxic centers are present in the pons. Good. Swati Kannan, that's great. Now look at this image. This can be image based question in your exam. This is a case of low voltage burn. What you can see here, crater formation surrounded by the blackish discharge, which is classical entry wound. So what is this injury? Can anyone identify this injury? Very commonly asked image based question. Crater formation, brown black discharge surrounded by grayish discharge, which shows the entry of electrocution. Yes, Swati Kannan, Sanya, Rakesh, what is this injury known as? This is classical Joule burn. Yes, good. Good answer. The second question, the repeat question, PYQ in your INICET exam. A 50-year-old died due to road traffic accident as a result of shock and hemorrhage. Identify the autopsy finding, the type of abrasion given below. So, options are graze, pressure, imprint and scratch abrasion. So, look at the image here. A case of road traffic accident, unnatural death. The investigation by police sub-inspector, we call it as police inquest as per 194 BNSS. Look at the injury here. Injury have parallel lines like this with denuded epithelium at one end. That shows the direction of the injury. What is this injury abrasion having parallel lines? Most common injury in road traffic accident? Yes, many answered correctly. So, the first answer is by Dheeraj, very good Dheeraj. It's basically graze abrasion. So, graze abrasion is the most common abrasion in road traffic accident, characterized by parallel lines with the denuded epithelium. It is also known as brush burn, also known as friction burn. Pressure abrasion, one classical example is hanging or ligature strangulation. When pressure is applied perpendicular to the body for a long time, there can be dry, hard parchmentization, which is classically known as pressure abrasion, frequently asked in the INICET. Imprint abrasion, you will see imprint of the weapon. Example, tire mark, radiator grill mark, or even ligature mark also. Example, tire mark. Scratch abrasion, one of the commonest abrasion in general. Scratch abrasion commonly seen in case of strangulation, that is manual strangulation. So, vertical, horizontal scratch marks, classical of manual strangulation or throttling. Scratch abrasion can be seen in case of sexual assault also. So, the best answer here is graze abrasion. One more frequently asked question in INICET, what is patterned abrasion? Patterned abrasion. Patterned abrasion is of two types. One is pressure abrasion, the second one is imprint abrasion. Okay, it includes both pressure and imprint. Good answer, good. Abrasion is a superficial injury which heals within 1 week. You can estimate the time since injury by looking at the color of abrasion. Yes, so this is about the second question, repeat question. Now look at this 4 images, try to identify types of abrasion. So this is A, B, C and D. So in A, you can make out clearly visible tire mark. In B, oblique ligature mark, dry hard parchmentization. In C, there is a linear abrasion which has significant length, insignificant width. In D, parallel lines are there. Can identify A, B, C, D? Swati Kannan and others? Ashutosh, Rakesh? Yes. So, A is basically imprint abrasion, B is pressure abrasion, C is scratch abrasion, D is graze abrasion. So, most common abrasion is graze abrasion. Good. Rakesh got the answer. That's great. Now, question number 3, repeat question from INICET. A 40-year-old comes with a daughter to hospital with a recent history of rape offense As you know, rape is defined under section 63 BNS, punishable under 64 BNS. Mother is claiming her daughter to be less than 18 years. As you know, less than 18 year, we call it as juvenile. It comes under POXO, that is protection of children from sexual offences. Most of the offences are non-bailable. But doctor does not agree. Which X-ray used to prove age more than 18 years? Options are wrist joint, medial end of clavicle and sternum, medial end of clavicle and skull, and the sternum. What is the best answer? Try. It's a very simple question. The best X-ray for estimation of age 18, it is wrist joint. It is not sternum. You know, the body of the sternum that is formed at the age of 25 years. The lower end that fuses with the body at the age of 40. The body fuses with the upper end of the sternum at the age of 60. It is not sternum. Skull basically sagittal suture is used for the estimation of age. That is not the answer. The medial end of clavicle at the age of around 25 years or 21, 22 years. 18-year answer is wrist joint. Okay, good. Now look at this X-ray and try to identify age of the person. Look at this and try. What you can see here in this X-ray. So this is radius. This is ulna. And you can see here it is unfused. Unfused. So what is the age? This is physiform, capitate, hamate, trapezium, trapezoid. This is scaphoid, lunate, triquetral. So all the carpal bones are there, including physiform. You can see the double shadow that is physiform. Radius is appeared but not fused. Ulna lower end appeared, not fused. My question is very simple. What is the age of this X-ray? Yes, good. Many got the answer. It is physiform appeared. Physiform around 10 to 12 years. The lower end of radius fuses usually at the age of 18 years. So it is more than 10 year, less than 18 year. That means minor, means juvenile. So it is punishable under POXO Act. So it is the case of POXO, section 4. Section 4 is penetrative sexual assault. We call it as PSA. So there are 5 definitions in the POXO. This can be asked in your exam. 5 definitions are: one is PSA, penetrative sexual assault; APSA, aggravated penetrative sexual assault when it is committed by the one known to the victim; sexual assault SA, aggravated sexual assault ASA, sexual harassment. There are 5 definitions. This is asked in your INICET. Most of the offences are non-bailable outside and non-compoundable and cognizable offence. Good. So Bharat, Swati, yes, good, that's great. Now look at this X-ray and try to identify what is the age. In this X-ray, the lower end of the radius is fused, lower end of ulna is also fused, even first metacarpal appeared and fused. So there is no gap. My question is, what is the age by looking at this X-ray? All the carpal bones are there, including physiform. 8 carpal bones. She looks too pretty, try to catch her is the mnemonic, as you know. What is the best answer? So, Swati Kannan, very good. It is more than 18 years. Good, Swati Kannan. Good, Ashutosh. Great. Now, look at this question. Very interesting question. Young male, aged about 26 years, married, used to maintain his livelihood from the poor income being an auto driver. A case of hanging. During autopsy, oblique ligature mark. So, ligature mark is present along with dribbling of saliva. Psychological autopsy showing depression, some financial problems, some domestic issues are there, some personal issues are there. So, options are suicidal hanging, homicidal hanging, accidental hanging, autoerotic hanging. Try. The findings are oblique ligature mark. Point number 1, dribbling of saliva is there. Psychological autopsy shows negative mindset, that is depression. What is the best answer? It is not autoerotic hanging, because autoerotic hanging, the clinical scenario is different. It is also known as Coatswarism, commonly associated with petechism or transvestism. Accidental hanging, autoerotic hanging is an accidental hanging. Accidental hanging while playing is very common in children's. Homicidal hanging is known as lynching. So, the best answer is suicidal. So, whenever option given dribbling of saliva is a feature of antemortem hanging, surest sign of antemortem hanging. That means the person was alive at the time of incident of hanging. So, go in favor of suicidal hanging. A is the correct answer. Good, Swati Kannan, Dheeraj, Saloni, Saroj Chaudhary, great answer. Good. Here 3 important MCQ commonly asked in your INICET. Surest sign of drowning, cadaveric spasm. Surest sign of burn injury, soot particles in the lung or in the trachea. Surest sign of hanging, antemortem hanging, dribbling of saliva. Okay? Yes. Now look at this. Most common inquest in India. As you know, inquest means inquiry towards cause of death. There are 2 types of inquest in India: police inquest, magistrate inquest. If the question asked best inquest, that is magistrate. So try. So answer is A is the correct answer. Police inquest means 194 BNSS. Very important MCQ. Police means sub-inspector or inspector, Diva SP. Magistrate inquest, it is the best inquest. The BNSS section is 196 BNSS. It is done in some special condition, like example dowry death. Exhumation. Death in psychiatric hospital. Death during police firing. Death in police custody. All is an indication. Dowry death is 80 BNS. Very commonly asked. So magistrate means usually executive magistrate like Tahsildar, AC, DC and all. Medical examiner is bestest. It is followed in US because medical examiner is a dual expert. He is a forensic expert as well as the expert in investigation as well. Coroner inquest, so that was there in India for some time, I think up to 1999 in Mumbai and Kolkata. So that is not followed right now. Answer is A is the correct answer. Okay, is it clear, guys? Next question. Factory worker in thermometer industry came with pink lesions following is seen in this poisoning. Pink lesion. Thermometer. So thermometer means mercury thermometer. Pink lesion, that means acrodynia. Acro means periphery. Dynia means pain, pain at the periphery. So this is probably a case of Mad Hatter's disease, Pink's disease, or mercury poisoning. Neuropathy, basophilic stippling, Meese line. What is the best answer? The Meese line is seen in case of arsenic and thallium poison. Basophilic stippling commonly seen in lead poison because of 5' nucleotidase inhibition. Neuropathy, that is commonly seen in case of arsenic or lead. It can be seen in mercury poison also. The best answer is Mad Hatter's disease. Okay, Mad Hatter's disease or erethism. So there are many names given to mercury disease, Minimata disease, acrodynia, Pink's disease, mercuria lentis and all. So after the class, go through mercury poison in detail. Frequently asked question. Great. Mad Hatter's disease. Okay, mercury poison. Now look at this and identify what is this finding. Image based question, guys. Can you try? What is this finding? Ashutosh, Swati Kandan, Saroj, Rajkumar. What are they finding there? Some area of hypopigmentation, or we can say white lines over the nail. Yes, good. Saloni Priya got the answer. Meese line, classical of arsenic and thallium. Not very specific. Good. Great. Now, this is INICET question asked recently. Medical data. See, medical data, see hospital details, age of the patient, identity of the patient. Details comes under which law? So, you need to maintain the patient detail with 100% confidentiality. The confidentiality is a part of patient autonomy. As you know, there are 4 principles of medical ethics: autonomy, beneficence, non-maleficence and justice. Patient autonomy, medical data security. NDPS basically narcotic drugs. Basically for narcotic drugs. PCPNDT basically sex determination of fetus. TOTA, that is organ transplantation. Transplantation of Human Organ and Tissues Act. DPDP Act is the correct answer. So the best answer, DPDP. DPDP means, you can see here DPDP, Digital Personal Digital Protection Act. So, the answer is DPDP. So, this can be asked in your upcoming exam. Okay, fine. Next question, the favorite of examiner, carbon monoxide and cyanide. Mechanism of cyanide or carbon monoxide poison is NADH dehydrogenase, succinate dehydrogenase, cytochrome C oxidoreductase, cytochrome C oxidase. All are the components of electron transport chains. As you know, there are 4 components. 1, 2, 3, there are static components and mobile components, which inhibits complex 4. I know it is complex 4. So, what is the best answer now? Can you try, guys? Can you try? Cytochrome C oxidase. Very good, Saloni. So, answer is cytochrome C oxidase. So, try to memorize complex 1. Complex 1 inhibited by these drugs: chlorpromazine, rotenone, amobarbital, pyrazidine. Complex 2 by malonate. Complex 3, that is ball antimycin. And complex 4 of forensic importance, carbon monoxide, cyanide, azide, hydrogen sulfide. Try to memorize. In carbon monoxide, there will be cherry red discoloration, cherry red postmortem hypostasis. Cyanide, brick red hypostasis. Cyanide is one of the most ideal suicidal or homicidal agent. Okay, so death occurs immediately or within few minutes. The treatment, we use 3 drugs: amyl nitrate, sodium nitrate, sodium thiosulfate. Frequently asked. Hydrogen sulfide, basically drainage gas. One very important question is Japanese detergent technique of suicide. When you mix hydrochloric acid or the harpic along with the bath sulfur, there is a production of hydrogen sulfide. This hydrogen sulfide inhibits complex 4, it can lead to sudden death. Remember the word Japanese detergent technique of suicide. Repeat question in INICET. Okay. And when I talk about cyanide, I remember 2 important real life incident. One is Curry cyanide case. Have you heard of Curry cyanide case? And cyanide Mohan Kumar case. One web series recently released is the Dahad. Dahad is a web series related to this cyanide Mohan Kumar case. And Curry cyanide is basically Jolly Joseph case in Kerala. Jolly Joseph was the murderer. She killed more than 5 people by mixing cyanide with the curry, food and drink. Yes, Swati Kannan? That's okay. Cyanide, remember bitter almond smell, repeatedly asked. Good. Jolly. Sanya, that's great. Jolly case. Now, the next question is from rule of 9. One question will be there either from rule of 9, Browder formula or Palmer rule or Parkland formula. Repeat question. Calculate the surface area of burn injury in the below case involving front of chest. So, front means 9%. So, front 9, back 9. Front of trunk 9, back is 9. Both upper limb. One upper limb is 9%. 9 plus 9. Face is involved along with the eyebrow. Not the entire face, I think probably the part of the face. Let's take this as 5. Okay. So, it is 27 plus 5 It's around 32. 32, yes. So the best answer 33 to 37. This rule is given by Wallace, rule of 9. Other rules are LB rule, that is in children, Palmer rule, that is in scattered burn, Parkland formula in giving IV fluids, commonly asked. Look at the rule: 9% head, 9% chest, abdomen, upper back, lower back, anterior leg, posterior leg and each, entire arm, genitalia 1%. Frequently asked. So this rule is very useful in prognosis also during postmortem examination. Wallace rule. So one patient palm is equal to 1%. Useful in scattered burn. Now question number 10, easy question but repeatedly asked. Blast injury. There are 5 types of blast injury: primary, secondary, tertiary, quaternary, quinary. Triad of punctate laceration. Punctate laceration we can make out here. Bruise and abrasion. The mnemonic is LAB. Laceration, bruise, abrasion. Options are blast injury, road traffic accident, firearm injury. Yes, firearm injuries are 2 given here. Okay. It is not C, definitely. Road traffic accident, you will see brush burn. So the best answer is blast injury, secondary blast injury. And this triad is known as Marshall triad. Marshall triad. Most common blast injury is secondary. The most common cause is flying missiles. Okay, flying missiles. Secondary blast injury. Great. So primary blast injury because of the blast wave. The most common organ affected are the tympanic membrane, the GIT and the lung. Secondary blast injury because of the secondary missile. Tertiary blast injury because of victim displacement. There can be head injury, there can be amputation. Quaternary blast injury is because of the structural damage, either due to electrocution or due to some fall of building and all. Quinary because of the radiation. Okay. Now look at this question. Very, very nice question. Commonly asked in the exam. A case of hanging. Come to forensic department for autopsy. The autopsy surgeon notices ligature mark covering 1/3 of neck, protruded tongue, salivary stain, open left eye, closed right eye. Both the pupils are dilated. What is the probable reason? So this classical finding, one eye is open, other eye is closed, is known as lay facies sympathetic. Lay facies sympathetic is because of compression of cervical sympathetic chain. So the answer is C is the answer. So the finding is lay facies sympathetic. It is not intrajugular vein or carotid artery or vagus nerve. Okay? Lay facies sympathetic. One more important question, Amsooth sign. It can be asked in INICET. Amsooth. Amsooth sign is transverse tear in internal or carotid artery. Okay, it is very common in case of judicial hanging. Good. Chalo. Next question, repeat question from INICET. According to Amendment MTP Act, opinion of 2 doctors needed in the following gestational age. So, what is the best answer? As you know, more than 20 weeks, up to 20 weeks, 21 to 24 weeks, beyond 24 weeks. So, 3 important questions. Up to 20 weeks, 1 RMP. 21 to 24 weeks, 2 RMP. Beyond 24 weeks, one important indication is congenital abnormalities of the fetus. Medical board. State level medical board. So what are the indications of MTP up to 24 weeks? When pregnancy is caused by rape, incest, minor, disabled woman, all are indication. So what is the indication beyond 24 weeks? Congenital abnormalities or structural abnormalities of the fetus. So this is commonly asked. So what is the best answer then? So the best answer is 21 to 24 weeks. Good answer. Good. Saloni Priya and others got the answer. Following is wrong statement. Among the 4, 1 is a wrong statement. Viper are hemotoxic. Yes, that is true. So viper are hemotoxic because of the presence of enzymes. So local symptoms are maximum in vipers. So viper can be Russell viper, saw-scaled viper, or it can be pit-nosed viper, hump-nosed viper, like that. So the answer is not A. Cobra belong to Elapidae, that is true. Elapidae means neurotoxic. It includes common cobra, common kite, mamba, coral snake. Hyaluronidase is common content of snake venom. Yes, that is true. Elapidae bites are myotoxic. It is false. Elapidae, they are neurotoxic because of presence of bungarotoxin, alpha bungarotoxin and beta bungarotoxin. So the answer is B is the correct answer. Rest all are correct. Now look at this snake and identify. Identify yourself. So this is one among the big 4 snake. You know, big 4s are common kite, common cobra, Russell viper, saw-scaled viper. Identify this, which has basically triangular head, constricted neck, broad body and a pointed tail, and it is nocturnal. Look at this, triangular head. Look at the fangs. The fangs are needle. What is this snake? Come on guys, try. Rakesh is telling, sir, viper. Yes, the answer is correct. This is classical Russell's viper. In Russell viper, you will see 2 or 3 rows of black or brown spots over the back of the body. So this is Russell's viper. The scientific name is Dubai russelli. So the clinical features are hemotoxicity. The local symptoms are maximum. The commonly used bedside test is 20 minutes, whole blood, clotting time, 20 WCT. The treatment is ASV. Common complication is acute renal failure. One of the unusual finding is bilateral parotid enlargement. The fatal period 3 to 4 days. The clinical presentation is hematuria. Yes. So, yes, good. This is about the question. We can make out here the fangs of the vipers are like a needle. They are curved. But in case of common cobra, they are short and they are not curved. They are straight basically. Good. Now look at this and identify. This is one forensic filmy funda question. Identify the snake. Options are common cobra, king cobra, viper, sea snake. Try yourself. We can make out the hood, spectacle mark, round pupil, round tail, neurotoxic. Clinical features are ptosis, abdominal pain. What is this? Saloniferia and others. This is common cobra. Common cobra, scientific name is naza. The king cobra, scientific name is Ophiophagus hanna. So, king cobra is bigger in size. Good. So, many got the answer. That's great. Next important question, repeat question. The finding in image is suggestive of which of the poison? The finding here is a chronic case of poisoning with some raindrop pigmentation. You can make out here raindrop pigmentation, RDP. What is this? When I talk about raindrop pigmentation, Meese line, the answer is king of all poison. The answer is arsenic poison. Arsenic. In lead poison, you will see Burtonian line. That is the bluish line at the junction of teeth and gum due to accumulation of lead sulfide. Again, it is non-specific. In mercury, that is Mad Hatter's disease, characterized by erythism. Mercurial lentis involving accumulation in the antral lens capsule. Thallium is king of all kings. You will see Meese line. Not only Meese line, also neuropathy, and one more is alopecia. So, the answer is arsenic. Just try to remember, arsenic, the fatal dosage is 200 milligram. It resembles like cholera. It's an ideal homicidal agent because it is tasteless, odorless compound. It can be mixed with any food and drink. King of all poison. Lead poison. Remember, lead encephalopathy, very common in children. The common route of entry is air pollution. MCQ. Okay? Good. Many, they got the answer. That's great. Now, the very nice question. Antidote used in cyanide poison. Cyanide is ideal suicidal, ideal homicidal, it inhibits complex 4, it causes histotoxic hypoxia and sudden death. There are 3 agents used. What are they? Amyl nitrate, sodium nitrate, sodium thiosulfate. Amyl nitrate given inhalationally, sodium nitrate, sodium thiosulfate are given intravenously because that produces methemoglobin. So, methemoglobin combines with the cyanide, cyanomethemoglobin which combines with the sodium thiosulfate, it forms water soluble compound, get X-rated. So, answer is amyl nitrate, sodium nitrate, sodium thiosulfate. So, all the 3, not the sodium nitroprusside. So, the answer is A, B, C. So, the funda is it produces methemoglobin Fp3+. It combines with cyanide, it forms cyanomethemoglobin. Cyanomethemoglobin combines with the thiosulfate, it forms stable water soluble compound and get X-rated. Okay, this is the important funda. Okay, good answer. That's great. Now, one image is given to you, very frequently asked, image based question. Look at this. This image, identify the seeds. The seeds are kidney shaped, double edged, brown in color. It consists of hyoscine, hyoscyamine and traces of atropine. Identify these seeds. My favorite question. Okay, image based question. Try. Ashutosh and others. जल्दी बताओ. Double edged है. So seeds are double edged. Point number 1. Point number 2, kidney shape. Kidney shaped. Brown in color. Consist of hyoscine, hyoscyamine. So what are these seeds? Try. Chili seeds, no beta, not chili seeds. No. Dheeraj, no. So these seeds are basically of datura seeds. So datura is a well-known deliriant. It is used as a road poison or rail poison, basically for robbery, kidnapping and sexual assault, and normally confused with the chili seeds. The treatment of datura is physostigmine. The clinical manifestations are 9D manifestation. So all starts with the D. You must be knowing dysphagia, delirium, muttering delirium, carpologia and all. So answer is physostigmine and datura. Good. Not the apple seeds. No. Saloni? No, it is not apple seeds. So they are classical datura seeds. Datura. Next question from sexual offences. Match the following sexual paraphilia. Paraphilia means abnormal sexual behavior to get sexual pleasure, sexual gratification. Proteiurism. What is proteiurism? Proteiurism means rubbing the private parts against the female body part in crowded places like buses, trains or marketplace. So what is that? So answer is A2. So this is basically 2. A2. Eonism is basically cross-dressing, wearing female dress, behave like female to get sexual pleasure. So B3. Necrophilia, sexual intercourse with the dead, necrophagia, sometimes lust, murder, sadism, extreme degree of sadism. Necrophilia, it is basically 4. Active algolignia inflicting pain to the partner to get sexual pleasure, known as sadism. So, what is the best answer? A2, B3. A2, B3, C4. So, answer is 2 is the correct answer. Okay. Transvestism, eonism. Transvestism basically cross-dressing. Both are same only. To get sexual pleasure, wearing female dress and behave like female, that is basically known as eonism. So, behavior is also like female, that is eonism. Only wearing cross dress, that is the transvestism. Okay. Sadism, giving pain to the partner. Taking pain is masochism, combination known as bondage. Necrophilia punishable under 301 BNS. So, all of you write in the chat box. Necrophilia, right? Necro is equal to 301 BNS. The punishment can be 2 years of imprisonment. So, write this in chat box, Rakesh and others. Necrophilia is equal to 301. There are others like peeping Tom, voyeurism can be asked. Okay. Gender dysphoria is different. Gender dysphoria basically that is desire to desire to change the gender. That's different thing actually. Fine. Try to understand. Voyeurism can be asked after the class. Go through that. Fetichism, exhibitionism. Exhibitionism can be of 3 types: mooning, streaking, and all. Proteurism, that is rubbing. Masochism, that is taking pain. Sadism, giving pain. Transvestism, that is opposite dressing, cross dressing. Pedophilia, that is with the children's, and others. So, this is discussed in detail in previous classes. Now, I have a question for you. Look at this and identify. What is this? So, male and female, male and female, and it's a public transport. Public transport. So, you can see here, what is this? Identify. And it is punishable under 74 BNS. That is indecent assault. What is this? Joy is telling, sir, proteurism. Good. It is proteurism. Good answer. What about this? Here is boy and a girl. The girl gets sexual pleasure by looking at inanimate object, that is tattoo. So, by looking at the tattoo, she gets the sexual pleasure and she insists to see the tattoo during sexual intercourse all the time. What is this sexual paraphilia known as? Come on, try guys. So, this is known as fetichism. Sometimes this fetichism is associated with autoerotic asphyxia and death. Good. Fetish, good. And the next question. A case of poisoning in a 40-year-old female who had consumed white, odorless, tasteless powder. Present with salivation, abdominal pain, flaccid paraplegia, weakness in the limbs, the weakness of the muscles, and there is a hypokalemia. As you know, normal potassium level is 3.5 to 5.5 milliequivalents per liter. So, what is the best answer? There is a hypokalemia, there is a paralysis, there is a paraplegia, which is used as an insecticide. This is hypokalemic paralysis. It is not arsenic beta. Arsenic not the answer. In arsenic you will see rice watery stool, that is cholera. Lead poison you will get basophilic stippling, lead encephalopathy, lead bands, basophilic stippling, anemia, facial pallor and others. Mercury poison, Mad Hatter's disease, acrodynia. So, the best answer is barium carbonate. Barium is used as a insecticide. Accidental consumption can lead to hypokalemia. This hypokalemia causes hypokalemic paralysis. Answer is A. No doubt. Good answer. Declaration of Oslo by World Medical Association in 1970 refers to Oslo is given by World Medical Association by doctors. Hunger. Hunger is basically Declaration of Malta. So, not the answer. Ethical aspects of medical research are human experimentation. That is basically Helsinki. Torture, Declaration of Tokyo. T for torture, हम torture नहीं करेंगे. ठीक है? Therapeutic abortion is the best answer. So, the answer is therapeutic abortion. So, very commonly asked, Rakesh, good answer. Now, try to remember 4 principles of medical ethics. This can be asked in your exam. There are 4 principles. So, what are 4 principles? The first one is autonomy. So, the autonomy includes confidentiality and consent. Second one, beneficence. Do good to the patient. Non-maleficence. Do not harm. And justice. So, this can be INICET question. Autonomy includes confidentiality and consent. Okay? Yes. Now, after the class, go through different World Medical Association declarations. Oslo, therapeutic abortion. Sydney, definition of death. Munich, discrimination. Helsinki, human experimentation. Lisbon, rights of patients. Venice, terminal illness. Tokyo, torture. Geneva, Hippocratic oath. Declaration of London, basically that is Code of Medical Ethics. Malta, hunger strike. Istanbul, basically torture. All these are frequently asked in your INICET exam. So, is it clear, Rakesh, Swati Kanna, Saloon, Ashutosh, beta, you are getting my point? Are you there, Ashutosh? Okay. Next question. During autopsy of fetus, correct order of opening cavities. Correct order of opening cavities. See, in examination of fetus, the main question is whether it is stillbirth or it is live birth or it is dead born. To find out that, you need to know about the level of diaphragm. The first cavity in general, it is abdominal cavity. A is the answer. To know the level of diaphragm. Simple question it is. Very simple. Then the question can be asked how to open the cranial cavity. So, there are 2 techniques, Beneke technique and bar technique. Beneke and bar. And the incision is inverted Y incision. So, this can be asked. Viability, that is 28 weeks in India. The center for viability is, that is thallus. The center for full term baby, that is lower end of femur, commonly asked. Good. Features of Korsakoff psychosis. So, Korsakoff psychosis is because of alcohol, chronic alcohol, because of vitamin B1. So, vitamin B1 basically for myelination. When myelination is affected, that leads to Korsakoff psychosis and Wernicke encephalopathy. So, what is the answer? So, Korsakoff psychosis characterized by amnesia, true. Compensatory confabulation, yes. Ophthalmoplegia is a feature of Wernicke encephalopathy. Polyneuropathy, no. So, what is the best answer? AC, even polyneuropathy also. If we take this, the answer is ABC correct answer. A, B, C. Even D also correct because most of the time it occurs in combination. So, remember the mnemonic, welcome to Goa. Wernicke encephalopathy, that is welcome. Global confusion, ophthalmoplegia, ataxia. Simple mnemonic. Injury over the skull showing innertable beveling. Cruciate entry wound. The weapon causing it is innertable beveling is there. So, innertable. Cruciate entry wound is there. It's cruciate entry wound. What is the weapon causing it? It seems to be firearm injury. It is contact entry wound. So, contact entry. So, the answer is bullet. Bullet is the correct answer. The hammer. So, that is heavy weapon with a small striking surface which can lead to depressed fracture. Scissor, not important. Iron rod, okay. So, I think D is the best answer. It's a classical case of contact entry wound. The cruciate entry wound, the word is there. It's entry wound. Outer table beveling, that is classical of exit wound. So, difference between entry exit wound, very important question in your INICET, go through after the class. Okay. The gutter fracture is caused by bullet. Gutter fracture. Now, look at this, identify this, what is this? This is a case of murder as per 194 BNSS and 103 BNS. During postmortem examination, there is a classical finding, the bone fragments are depressed into the skull, causing brain damage caused by heavy weapon with a small striking surface. What is this basically? Is it linear fracture, depressed fracture, hinge fracture or pond fracture? What is this? Good. Many answered correctly. It is basically depressed fracture, also known as signature fracture. Fracture ala signature, name given to depressed fracture. Okay. Hinge fracture, also known as motorcyclist fracture. Frequently, there are 3 types of hinge fracture, 1, 2, 3. Fall from height, the fracture occurs around the foramen magnum, that is known as ring fracture. Most common fracture, linear fracture. Pond fracture is known as ping pong fracture, common in children. Okay? Very commonly asked, many got the answer. Saloni Priya, excellent answer, great. Now look at this and try to answer. What is this? This seems to be firearm injury. You can see here, there are certain injuries are there. My question is, what is this injury? Again, a case of murder during examination, there is an entry wound, inverted margin, abrasion color, grease color, and tattooing is there. So, my question is, what is the range? Is it contact shot, close shot, near shot, distant shot? Come on. Yes, yes, try. So, this is tattooing. Tattooing is caused by unburnt gunpowder. So, what is the range? Yes, Ayush Shukla, can you try? Ayush Shukla, yes, very good. So, tattooing near shot. So, when you see blackening close shot, when you see cruciate entry wound, that is the contact shot. Good answer. Good. Many got the answer. That's great. Now, next question. Following crystals are seen in which of the following? The finding is colorless bipyramid shaped crystals of calcium oxalate. You can see here calcium oxalate. Options are ethylene glycol, methyl alcohol, aconite, OP poison. OP poison is ruled out. In OP poison, the clinical features are different. Mnemonic is sludge MTF. Aconite is queen of all poison. It's a cardiac poison. Methyl alcohol, no. Methyl alcohol, you will see formaldehyde, formic acid. They causes optic neuritis and serum depression and death. Ethylene glycol is the correct answer. So, in ethylene glycol poison, you will see crystals. One more condition, remember, oxalic acid. In oxalic acid also, you will see same type of crystals in the urine. No doubt in that. Oxalic acid is a salt of sorrel, acid of sugar. Okay. It affects the kidney, basically proximal convoluted tubules. Answer is ethylene glycol. Can anyone tell me what is the drug used in ethylene glycol poison? What is the drug used? Drug of choice. The drug of choice is fomepizole. Fomepizole is also used in methyl alcohol poison. The fatal dosage of methyl alcohol 60 to 200 ml. Good. So, now I have some image based questions. Frequently asked in INICET, guys. Frequently asked image based question. Are you ready for the image based question? Ready? Come on, guys, say yes or no. How is it, Josh, my dear students in forensic class? Josh should be high all the time. Try. Are you ready for the image based questions now? So, now there are 10 image based questions are there in next 5 minutes. Try. Yes, Saloni Priya. Okay. Chalo. Okay. First question. Take your time. During postmortem examination, unnatural death, there is a finding. The finding is abnormal postmortem hypostasis. This is contact flattening. Okay. Contact pallor. Look at the borders. The borders are well defined. Present over the dependent area. Cherry red discoloration. Whenever question asked, INICET, cherry red discoloration, image based question, pakka answer, carbon monoxide poison. So, very good. Carbon monoxide. Then question can be asked, what is normal color? Purple color, bluish red color. What is the color in yellow phosphorus? Yellow color, dark brown color. Opiate, black color. Green color, hydrogen sulfide. Aniline, that is chocolate brown color. So, commonly asked. Postmortem lividity, carbon monoxide poison. The first answer is by Dheeraj. Dheeraj, very good. First question went correct. Second question. Second question, guys, look at this. A patient came with a history of chronic arsenic poison. On examination, there is areas of hypopigmentation. Classical of arsenic poison. The drug of choice in arsenic poison is ball. Okay? What is this finding? Without option. Swati Kanda and others. Try. So, this is arsenic poison. Arsenic fatal dosage, I said 200 mg. King of all poison. Drug of choice is ball. So, ball is given orally or intramuscularly, never intravenously, because it consists of peanut oil. Yes, very good. So, this is a raindrop pigmentation. Then again, arsenic, ball, very commonly asked. Ball is contraindicated in 4 conditions. Can anyone tell me what are the 4 contraindications for ball? Jaldi batao. 4 contraindications. Ball, British anti-leviside, drug of choice in arsenic poison. What are 4 contraindications? Mnemonic is PYQ. You need to identify that PYQ. What is PICO? PICO. P, that is peanut allergy. I, iron poison. C, cadmium poison. O, organic mercury poison. PYQ. So, very good, many answered. Not lead. Swati Kandan, it is not lead. So, cadmium causes iti disease. Frequently asked. Ouch, ouch disease. So, iron we use desferoxamine, that's simple question. Okay, chalo, ho gaya. Second question went correctly. Third question from thanatology. So, now I am in postmortem room. Look at the image there. There is a finding, a triangular patch is there. A triangular patch. Look at this. So, time since death is 3 to 4 hours. A black, a brown, a yellow color patch over the eye, over the sclera, adjacent to the cornea. What is this finding known as? It is because of desiccation and dryness of the tissues. When eyes are open, seen in 3 to 4 hours. Yes, very good, Dheeraj, excellent answer. This is Tachynoria sclerotica. So, eye findings are very commonly asked in INICET, especially Kevorkian sign, frequently asked. Kevorkian sign is fragmentation of blood in the retinal vessels. So, time since death here is 3 to 4 hours. Frequently asked. Okay. Kevorkian sign, commonly asked. Third question, the first to answer by Dheeraj. Dheeraj, excellent answer, beta. Excellent. Great. Great. Good. Then, very important question. My favorite question in INICET. Now, we are in the crime scene. We are using some reagent in the lab. What you can see here, dark brown rhombic crystals are there. Dark brown rhombic crystals. So, this is a case of blood stain. So, what is this test? So, blood stain we use multiple tests. The confirmatory tests are Takayama test and Teichmann test. My question is it Takayama test or Teichmann test? So, dark brown rhombic crystal, your answer should be Teichmann test. In Teichmann, you will see dark brown rhombic crystal. Takayama, you will see pink feathery crystal. So, how to remember? Takayama is there. You can remember Mama. Takayama, Taka Mama. Mama is pink. Pink mama with a feather. Okay. So try to memorize this. Consider he is your mama. So Taka Mama. So Takayama, Taka Mama, pink feathery crystals. Dark brown rhombic crystals, they are basically Teichmann test. Other test is, that is spectroscopic examination. That is the best test for blood stain. If it is old blood stain, luminol reagent is used. Yes, yes guys. Takayama, pink mama. Can you able to remember? Dheeraj Kumar, say thank you to our Pinky. Pinky is a special guest today, just to explain Takayama test. Say hi Pinky in the chat box, so you can relax for one or 2 seconds. You can tell some thanks to our Pinky. Pinky is here today. Beautiful Pinky. है ना? Swati Kannan, are you there? चलो हो गया. पिंकू, अच्छा ये पिंकू है, पिंकी है, पिंकू नहीं. अच्छा पिंकू मामा है ना, पिंकू. Cute Pinky. Yes, great. Then one more question asked. Seminal stain. In seminal stain we use, right here, seminal stain. Frequently asked. In seminal stain we have Barberio test. Barberio test, the finding is yellow needle shaped crystals. Yellow needle. Because of spermine picrate. We use picric acid in Barberio. Then Florence test. In Florence, same dark brown rhombic crystals of choline iodide crystals. Choline iodide. Okay? Try to understand 4 tests. Barberio Florence for seminal stain. Takayama Teichmann for blood stain. And other tests for blood stain are Barberio test, no, not Barberio, benzidine test, tetramethyl benzidine test, Castle-Meyer test, luminol test, tetramethyl benzidine test, then other test. Okay, ho gaya. Now this question, very, very important question. Very important question. Try to answer. So Dheeraj and others. This is a case of drowning. So in drowning, there is some important finding with the mud aquatic plant in the hand, which is antemortem phenomena. What is this finding known as? Come on, try. So this is basically antemortem drowning. Antemortem drowning. In antemortem drowning, you will see cadaveric spasm. Cadaveric spasm is also known as cataleptic rigidity. It is a surest sign of drowning, antemortem drowning. The pH in case of cadaveric spasm is alkaline, and it is antemortem all the time. It shows the manner of death, whether suicide, homicide or accidental. Okay? Yes, that's great. Now this question, no options. This is again a plant, organic irritant. The fruits are there in clusters. You can make out here. Fruits are there in clusters. What is this? Try. Clusters. C for clusters. C for. Yes, yes, better. Yes, Dheeraj. Diatom also. Diatoms also the surest sign, but the best sign is cadaveric spasm. Both are there. Okay? So many said, sir, ये thorn apple. No, beta, thorn apple nahi hai. Thorn apple occur singly. Here, clusters. Clusters are there. When clusters are given, answer is castor. Resinous communis. So the seeds are very shiny. They inhibits RNA polymerase. They inhibits protein synthesis. The very famous case of Ricinus communis is umbrella murder case. Umbrella murder. The fatal dose is 10 seeds. Fatal period 3 to 4 days. The cause of death, multi-organ failure. It's an organic irritant. Castor is the correct answer. Okay? Good. The fifth question, okay, I think only few answered. So funda is when clusters, castor, single, torn apple, datura. Seventh question. Look at the seventh question. In seventh question, there is a snake, very big snake with the hood. Hood is there. No spectacle mark. What is this snake? I need scientific name because asked in INICET, what is the scientific name of this snake? So, this is basically king cobra because spectacle mark is not there, large size. The scientific name is Ophiofagus hanna. The cause of death, respiratory paralysis. Neurotoxic, it produces bungarotoxin. One of the most venomous snake. The person dies within few minutes because amount injected, the venom injected is very high. So it can kill an elephant also. Not naza, Ophiofagus hanna is the correct answer. Okay, great. Then the eighth question, very important question, frequently asked in INICET. Look at this. This is the plant which is having yellow flower. All seeds are there. These are mustard seeds. So the clinical condition characterized by swelling of the limbs, both the limbs, glaucoma. What is this condition? Edema of the limbs. What is this seeds and what is the clinical condition? Let's see who is going to answer this question. So the name given to this is pricky poppy. Yellow oleander? No beta, it is not yellow oleander. Good, Saloni Priya answered, sir, it is Argemona mexicana. Argemona mexicana. The active principle is sanguinarine. It produces epidemic dropsy. Epidemic dropsy. So, three important points. Yes. So, no, Saloni Priya, that is different. BOAA, that is beta oxalyl aminoalanine, that is neurolatheriasis. So, the answer is pricky poppy. So, try to memorize these three conditions. Epidemic dropsy, I said, non-inflammatory bilateral swelling of the limbs, sanguinarine, so Argemona mexicana. Neurolatheriasis, which is a crippling disease caused by BOAA, beta oxalyl aminoalanine. Adulterant is Kesari dal, Lathyrus sativus. Endemic ascites, that is basically pyrazolidine, which is basically hepatotoxic. Very frequently asked question. Pakka question in your exam. Okay? And question number 9. Fingerprint. Identify this fingerprint. A, B, and C. So, fingerprints are formed at 24 weeks of gestation. There are 4 types of fingerprint: loop, arch, oval, composite. Most common is loop, least common is composite. It was first established in India by William Herschel and Francis Galton, improved by Henry. identify these fingerprints. So A looks like this, B looks like this, C looks like this. What is this? So in B, 1 delta, 1 core. In C, 2 delta. In A, no core, no delta. What is this? Core means curving ridge. Delta means 3-directional meeting point. Yes, Harish, okay, first to answer by Dheeraj again, Sanya, Rakesh, Harish Shami, Swati Kannan, Saloni Priya, great answer. So, A is arch, B is loop, C is oval. So, 9th question, many answered, that's great. And the 10th question, method of age estimation in dead person after the age of 25. Frequently asked. So, try to memorize, this is frequently asked. So, in crime scene, say example me forensic expert, we are there in the crime scene. In the crime scene, we have a skull. The age is probably more than 25, but we do not know whether it is 35, 45, 55 like that. So, any method to estimate the age of the person by looking at the teeth, by looking at the macroscopic examination, by using the front teeth, frequently asked in INICET. What is this? Ashutosh. So, if you answer, I will sing a song for you. Anyone? Come on guys. Let's see. Dental beta up to 25 years. My question more than 25 years. Age estimation by using macroscopic examination. Macroscopic examination of teeth changes. Come on. Yes, Swati Kannan. Kiloscopy beta no. Kiloscopy, that is lip print, not the answer. So, the first two answer is by Swati Kannan. Excellent answer. Great answer. Salam. Okay. So, the answer is Gustafsson. INICET question. It has 4 components, 6 components, AP, SR, TC. So, all of you write in the chat box, AP, SR, TC, Andhra Pradesh state, some transport authority or something, AP, SR, TC. A means attrition, that is wear and tear. P is parodontosis, loosening of the teeth. S for secondary dentin. R for root resorption. T for transparency. C for cementum opposition. So, frequently asked. So, try to memorize. Rakesh, good, okay. Attrition means wear and tear. Parodontosis means loosening of the tooth. Secondary dentin, calcium deposition. Root resorption, decrease in size of the root because of osteoclast. Transparency increases as age advances. Cementum opposition characterized by incremental lines. Now I have a question for you. Which is the best criteria? Which is the second best criteria? So Harish is telling root resorption is the best. No, beta, not root resorption. What is the best criteria? So the best criteria is transparency of the root. Best. Second best criteria, secondary dentin. So try to memorize. It is not primary dentin, it is secondary dentin. That is the best criteria. Okay, Saloni Priya, yes, that's great. Yes. Now teeth formulae. Universal method. That is 1 to 32. So 1 to 32 if it is given, that is universal. FDI, this is FDI, 1, 2, 3, 4, clockwise manner. Modified FDI, this is modified FDI. Okay, fine. And I have some more question now, some more interesting question. Look at this and try to answer. So we started some new series, forensic filmy funda, some 5 questions at the end. So just to make the class interesting. Yes, Saloni Priya and others, try. Identify the snake. There are 2 snakes. One has a hood, one has so common cobra and Russell viper. Cobra and viper. Good. The second question. The impulse of killing people in cannabis addiction known as. Options are run-amok, trichotillomania, homicidal impulse, culpable homicide. So this is commonly seen in case of cannabis poison or ganja intake. So ganja intake characterized by impulse of killing people. So that is known as run-amok. That is impulse of killing So the cannabis preparations are bhang 10 to 15%, ganja 15 to 25, charas 25 to 40, hashish oil 60%. So mazoon is sweet. So cannabis causes amotivational syndrome. Frequently asked. What is the principle of cannabis? 9-tetrahydrocannabinol. So answer is run-amok. Many answered correctly. So what is the active principle? 9-tetrahydrocannabinol. 9 THC. So cannabis is deliriant. Now next question. Injury to the hand while sitting next to the window seat most commonly causes which type of laceration? Look at the video and try to answer. Options are cut laceration, avulsion laceration, split laceration, stretch laceration. So what type of laceration is this? Look at this video once again and try to answer. So laceration commonly asked, laceration caused by blunt object. So there are 4 types are there. So what are 4 types? One is split laceration. Commonly occurs in bony prominences. Stretch laceration because of pull with the pressure. Tear laceration. Then we have avulsion laceration. Avulsion characterized by flaying, that is nothing but detachment, or amputation, or deglowing. So this is INICET question. So what is the best answer now? Is it cut laceration? No, it is not cut laceration, beta. Whenever amputation is there caused by the blunt object, either it should be avulsion laceration or it is stretch laceration. I think this is avulsion laceration. So here there is a deformity by the blunt object. Answer is avulsion laceration. Look at this, flaying, amputation, deglowing, the classical of avulsion laceration. Good. So this completes the most important questions, the most commonly asked question in INICET along with the previous year questions. If you have any doubt, you can ask me. Yes, Dheeraj and others. Any doubt? Yes, Bharat, definitely there will be an FMGE class as well. So don't worry, we'll help you in that. Yes, Swati Kannan. Okay. Good, good. Now I have 1 or 2 maneuver. I'll show you. Okay. Now I have a question. All of you listen to me and try to answer. So here husband and wife. Okay. The husband and wife staying separately. So brownie is husband, pinky is wife. Husband and wife staying separately. There is some domestic dispute between them. The case is in the court. The brownie is having intercourse with the wife without her consent, forcibly. My question, what is the BNS section for that? The BNS section related to husband having intercourse with the wife without her consent when wife is staying separately from him. What is the BNS section? Good question. Brownie and pinky question. Yes, Bharat CL. Try. Can anyone try? Options are 66 BNS, 67 BNS, 68 and 69. Okay. 66 BNS, 67 BNS, 69 BNS, 70 BNS. So very commonly asked. Can anyone try? Try to memorize. 66 is rape and murder. 67 I said husband. Husband-wife story. 69, that is false promise of marriage. False promise of marriage. 70, gang rape. So very, very important question. And one more very commonly asked, 63 and 64 BNS. 63 rape, 64 punishment. Commonly asked. I think husband, I think Debank got the answer. So 68 is authority, I said in the previous class. Answer is 67, correct answer. Okay. Then I have one more question. What is the classical finding in throttling? So now pinky is here, hand and throttling. What is the classical finding over the neck in case of manual strangulation or throttling? Frequently asked in INICET exam. Very, very commonly asked. Look at this and try to answer. Yes, come on, try. Try, guys. Yes, Dheeraj Kumar answered, sir, it is sixpenny bruise. Very good, sixpenny bruise. Inverted hyoid bone fracture, inward fracture of the hyoid bone. Yes, very good, Debank, and correct answer. Great, you are awesome, you are expert in forensic. Now I have one more scenario. Now this is my hand, elbow. Constriction of neck at the elbow bend like this. What is this known as? The constriction of pinky at the elbow bend and knee bend leading to asphyxia and death. इसको हम क्या बोलते हैं? Options है lynching, birking, Bansdola, mugging. Yes, Rakesh is telling, sir, mugging. Mugging is the correct answer. Good. Good answer. चलो हो गया. Okay, wish you all the best, guys. All the best for upcoming INICET exam. If you have any doubt, you can message me in the Instagram. You can message me in any platform. We are there to help you as a team of PW Meded. Thank you all. Thank you all. I hope class was interesting and class was useful for our upcoming classes. So I kept so many images in the class and in between some videos just to make forensic class interesting. I hope you enjoyed it. I hope you will remember all the important mnemonics like discussed today. Takayama test, pink mama. Teekman test is brown man, brown rhombic crystal. Barbario, yellow needle shaped crystal. Florence, that is the rock, dark brown rhombic crystals. So yes, Swati Kannan. So good, mugging, many answered. That's great. So many answered. Rakesh answered, Swati Kannan answered, Dheeraj answered, Debank answered, Salonu Priya, Harish Sami, many answered. That's really nice. That's really great.